Today we are going to talk about the practical tips of high frequency. التطبيق العملي للhigh frequency. Once you decide to shift the patient from conventional mechanical ventilation to high frequency, why you would like to shift the patient from conventional mechanical ventilation to high frequency ventilation? Due to failure of conventional mechanical ventilation and due to high frequency used as rescue therapy. What is the causes of conventional mechanical ventilation failure? Oxygenation failure, ventilation failure, perfusion failure. Oxygenation failure, this means the patient cannot maintain his oxygen saturation, or the saturation is than 90 despite of what? Higher oxygen requirement. The second, the BAFO. What is BAFO? Partial pressure of oxygen from blood gas divided, should be ABG, divided in FiO2 less than 150. If the BAFO or BF, this is partial pressure of oxygen from the blood gas, divided in FiO2 oxygen from the ventilation or oxygen requirement, the input and output, it will less than 150. This indication of oxygenation failure. Oxygenation failure, or oxygenation index is more than what? 15. Oxygenation index more than 15. This is the map times Fi2 oxygen requirement divided in the partial pressure of oxygen from the blood gas. It will give you the oxygenation index. So if there is oxygenation failure, ventilation failure, perfusion failure, this is the causes to shift the patient from conventional to high frequency as rescue. So this is oxygenation failure or ventilation failure. The patient is actually accumulating CO2 on the conventional mechanical ventilation on the high setting. You reach it to higher setting and still the patient is accumulating CO2, cannot eliminate the CO2. This is indication to shift the patient from conventional to high frequency or perfusion or problems or air leak. So you your decision to shift this patient from conventional to high frequency due to conventional mechanical ventilation failure and high frequency as rescue. What are you going to do? You have two strategies. High volume strategy, we call it open lung strategy, recruitment strategy to prevent the atelectasis or atelectic trauma, to prevent the atelectasis. And the second strategy is this: you have to increase the MAP. It will be 2 centimeters above the MAP from the conventional mechanical ventilation. For example, the MAP in conventional mechanical ventilation, it was 10. Once you shift the patient from conventional to high frequency, you have to increase the MAP to 12 in high frequency. It call it high volume strategy or low volume strategy. If there is air leak, you have to keep the MAP same. 10 in conventional, you have to keep it in the high frequency as 10. If in case of low volume strategy in air leak, so the high frequency, it's called it what? It will be high constant pressure or descending pressure. High, why is high? High to actually is high to open the lung, to make it lung recruitment, constant or descending pressure to keep the lungs open to prevent what? Atelectasis. So you have two strategies to protect the lung from the ventilation associated injury, because the pressure is constant, the MAP is constant, so will prevent atelectic trauma, volutrauma and pyotrauma. And also high MAP, because you are increasing too from the conventional, so to keep the lungs open or to achieve the lung recruitment and for open lung strategy. So the first action or practical point, if you shift the patient from conventional to high frequency, depend on the lung pathology. There is the atelectasis, so you have to go for high lung strategy to increase the MAP by 2. If there is air leak, you have to go for low volume strategy to keep the MAP same. So the first step to shift the patient from conventional to high frequency, so initial MAP increase by 2 centimeter above the MAP in conventional. For example, the MAP in conventional 10, if you shift him to high frequency, you have to be 12. It will be 12 centimeter water. The next step, actually, it will progressively increase the MAP by 1 to 2 centimeter water, increase until to reach what? To oxygenation improvement. You need this premature baby, the oxygen target, it will be between 90 to 95, and the full term baby, it will be 94 to 98. So you have to increase the MAP to open lung strategy, recruitment to open the lung until to reach it to a target oxygen saturation, Then after 2 hours you have to do X-ray. What is the indication for X-ray? First, as baseline. Second, just to look for the lung volume. Third, if there is any deterioration or new pathology or there is pneumothorax, you have also, this is to indication for the X-ray. X-ray as baseline, looking for the lung volume, and if there is sudden deterioration of there is air leak. So after 2 hours, you have to do X-ray. For what? I have to assess the lung volume. Why I would like to assess the lung volume? To adjust the MAP. Shall we increase the MAP, to keep the MAP, or decrease the MAP? Depend on the lung volume in the X-ray. And also, don't forget your clinical assessment. You have to look for the waggling. What is the meaning of waggling? This is the chest movement, the chest rising. The normal waggling, it will be reached to the groin or the symphysis pubis. If the waggling is reached to the umbilicus, this means you underventilate the lung. If reached to the side, this means you are overventilate the lung. This is clinical assessment to know you are underventilate the patient or overventilate the patient by the waggling, because the high frequency is what? CPAP with waggling, with chest movement, with chest rising, should reach to the groin or the symphysis pubis. If it's in the umbilicus, this is underventilate. If reach to the side, this means you overventilate. So I have to do X-ray after 2 hours. Then I will assess the lung volume. What is the normal lung volume? Between 7 to 9. 7, it will be 8. Depend on the reference, actually. It will be between 7 to 9. It will be 8. In some reference, it will be 9. Same this reference. So if the diaphragm less than 9 reps, you have to calculate the rep posteriorly. It will be if the diaphragm less than 9 reps, so you have to increase what? Increase the MAP, because you are not ventilate the lung properly. Otherwise the baby, it will desaturated. So if diaphragm less than 9 reps, you have to increase the MAP. If the diaphragm at 9 reps, because we're normal between 7 to 9, some reference to like 8 reps. So if at 9 reps, so you have to keep the MAP same. If the diaphragm is more than 9 reps, it means you are over ventilate the lung. You have to decrease the MAP. So once you decide to shift this patient or to switch this patient from conventional to high frequency, you have to know what is the lung pathology you are treated. You are treating lung pathology like atelectasis, or you are treating air leak. So if there is atelectasis, you have to go by high volume strategy to increase the MAP from conventional to high frequency by 2. If the MAP in conventional 10, you have to increase to 12. If there is actually air leak, you have to go for low volume strategy and keep the MAP same. So first of all, initial MAP 2 centimeter water above the MAP in conventional mechanical ventilation. This is the first step. The second step, you have to progressively increase the MAP by 1 to 2 centimeter water, increase until what? Oxygenation improve, until the oxygenation improve. This is the second step. The third step, you have to do chest X-ray after 2 hours, 1 to 2 hours, to assess what? To assess the lung volume. You can use it as baseline, assess lung volume. If there is any deterioration, also you have to do X-ray. So you have to assess the lung volume normal between 7 to 9. It will be 8. Some reference it will be 9. So you have to check. If the diaphragm less than 9 reps, you have to increase the map by 1 to 2 centimeter water. If the diaphragm at 9 reps, so you have to keep the map same. And if diaphragm is more than 9 reps, you have to decrease the map. You have to decrease the map by 1 to 2 centimeter. And don't forget your clinical assessment. Don't forget your clinical assessment. If you don't have chest X-ray, you have to look for the chest waggling. Chest waggling. If there it should be in the groin or symphysis pubis. If in the umbilical, this is under ventilate. If in the side, this means you are over ventilate. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.